Gather equipment required. Prepare the patient, exposing the central venous catheter to allow examination of the fracture and establish if a repair is possible. Clean the needle-free device with chlorhexidine wipe for 30 seconds, then allow to air dry. Flush the catheter to examine the site of damage where the repair will be required. Apply clamp above the damaged area of catheter, allowing room for the repair to be performed. Now prepare the repair kits for use. Attach the needle-free device to the new section of catheter and prime the catheter with sodium chloride 0.9%. Fill the Lurlock syringe with the adhesive glue. Attach the cannula to allow for easier application. Clean the external section of the catheter with a chlorhexidine wipe. Using sterile scissors, cut the catheter at the chosen repair site, keeping the cut as straight and neat as possible. Attach the new section of catheter by inserting the metal rod into the inner lumen of the remaining catheter. Ensure outer lumens of old and new catheter are joined together. Apply adhesive glue at the join site to secure the join. Then position the plastic sheath over the join site. This is to provide additional protection to the join. Fill the plastic sheath with adhesive glue from top and then the bottom. The glue will take up to 24 hours to set and hold. For improved success, we recommend to leave this as long as possible. Plastic rods are used to splint the repaired section of catheter. This section should then be wrapped to secure the splints. It is important to ensure the repair site is kept straight while the glue sets. A port protector should be applied to the needle-free device for further protection. The catheter should remain clamped above and below the repair site for 24 hours to prevent any movement within the catheter that could compromise the repair. The catheter can be further secured, wrapped or dressed as per local policies. After 24 hours, the catheter should be tested for patency and examined for any potential leaks at the repair join site. If the repair is successful, the catheter can be used as normal.